right, let's get started. Good morning, everyone, and good evening for those of you in Asia. So today we wanted to talk about the importance of research in the entire math journey. As you know, it is becoming increasingly important because of the competition. So we'll talk about all of that as part of this webinar, and we are also very excited to introduce our course research. So that will be the focus of today. And before we proceed, I just wanted to introduce the team, the panel here. So my name is Pawan Khera. You may have seen me on the USMLEsarthi videos. I'm an adjunct at Carnegie Mellon. I teach on healthcare analytics, and I have two more members from our team today. So I'll just ask them to introduce. So Rahul, do you want to go?
Yeah, sure. Good morning, everyone, and good evening. My name is Rahul Panala. I'm a gastroenterologist, and I'll just sort of give you, sort of my perspective, having been and actively being involved in research and having interviewed many candidates, how this helps differentiate you and why this is really important. So look forward to speaking with you. And Sachin?
Yeah. So myself, Achin Patel, I have done my medical school and master's in public health with biostatistics in major. I have been part of lots of research projects before and was able to publish several articles. And I'm looking forward to join the team here to guide the prospective residency applicants to have their publications.
Thank you, Achin. So let's move on. For those of you who don't know us, Lucas. Yep, sorry.
No, I was just curious. Are people able to hear Achin? Sometimes there was a little bit of a gap, I think. I just want to make sure people can hear. Okay.
Yeah.
Okay. Yeah. Okay.
Okay. Sounds good.
Okay. Good. All right. So what do we do? For those of you who do not know us, we actually help IMG and the Caribbean students through their USMLE journey, other than the exams for now. So that includes the ERAS application, the personal statement, interview prep. We also help you in your elective rotations, externships, so USCE, program selections, which program to apply. So we do that, how to communicate with the programs, how do you reach out to the programs, post-interview communication, even if you need us in SOAP. And now, of course, as I mentioned, we are very excited to start our new course on research, and we'll talk about that towards the end. So that will be another offering to help you. How we do all of this is we do it as part of the classes. So we have group classes. We have physician mentorship. So you're assigned a physician depending on the plan you have, and the physician will guide you end to end till the end of the math journey whenever you match. And of course, we do have a strong community. We have our closed groups on Telegram, WhatsApp, where we also provide guidance in a closed setting. We do have a diverse panel of attendings, residents, IMGs, AMGs, Caribbean students, US journalists. All this information and their credentials are on our website, so do look up that if you need to. In terms of results, obviously, this is the most important thing. We've, over the past 4 years or so, we've guided more than 700 students. We have a very healthy match rate of more than 86%. And we have students from over 24 countries now. All the typical specialties that you can see, including some of the very hard ones. In addition to IM, FM, Neuro, Ped, Psych, you will see diagnostic radiology, OB-GYN, anesthesiology, so on. Score range, of course, low scores, multiple attempts to over 270, recent graduates, old graduates. So we really help, candidates with a variety of profile. If you have any questions, check out our website. There are contact information right here. You can call us, WhatsApp us, email us. And before we proceed, here are some of the other free resources. We have a lot of videos, guidance for you on YouTube, so look it up. Just type in USMLEsarthi. You will see more than, I think, 80 videos now. So very helpful guidance. We have webinars, we have interviews, all those. And then there is a blog site. So, we have now all the Q&A that you have, the general questions, blogs, we are starting to use this site, a lot of traction. So most of your questions may be answered on this site. If not, you can ask questions here. You can also respond to the questions that others ask. So having said that, let's move on to the topic of today, which is how to help you leverage your research. What exactly is research? How does it help you in match? So the first thing I want to open up to my panel is the role of research in match for the IMG students and for the Caribbean students. So Rahul, if you want to start with that, and what is the role of research and how can IMGs use that in the match process?
So yeah, I think the main issue, and feel free to ask questions in the chat thing if you have any questions about what I'm speaking about. So the main thing to think about, as you all know, the match is getting very competitive. There's like nearly, if we look at the recent data, there will be more than 300 applications for every spot. So, and nearly half of all the applications are sort of not even reviewed in depth. So one is you have to really differentiate yourself. And by differentiate, you have to do something that will really, just getting scores and just going through medical school is not really enough to get you a good residency spot. Now, and then it also really depends on the specialty, if you and the type of hospital you want to get into. Now, if you want to get into an academic hospital, if you want to get into a university hospital, being a part of a research, program, or having published and having shown an interest and an enthusiasm for research is kind of mandatory, because the people who are going to apply along with you will have publications. I mean, it's gotten to a point where, just to give you an example, like yesterday we were, it was a first-year medical student in our hospital who had approached us, and we're starting a project with her. So you're competing with American graduates who do this day in and day out. So you really have to do that. The other aspect for international graduates is most medical schools outside don't really pay attention or teach you anything. And about research, about the methods of how to do it. And so when you do get into residency, it becomes quite challenging. So it's important to acquire those skills. And for certain specialties, like, if you want to get into anesthesia, if you want to get into really surgery, anything else, those are the super competitive specialties. You really, for international graduates, need to have a very, very strong research background. Now, the other aspect of it is a lot of international graduates obviously take time off, preparing for the exam. So you really have to balance a lot of deficiencies in the CV because of gaps, things like that. So for you to differentiate yourself, you need to bring up something else in your application, and research can be very important to that. And then the last thing is, as sort of when you're evaluated, when your application is evaluated, what people look for, what the research tells us is whether you can take on something and then be able to complete that and be able to be productive and actually deliver. So, and that becomes a very objective assessment. So if you spent 6 months with someone, you took on 2 projects or 3 projects, how many of those have you presented as a poster? How many of you have, turned into a manuscript? So that becomes very, very critical. So look at it as a very critical component, just like you look at it as your scores, your everything else that you do. I think it becomes very, very important if you really want to be competitive in this sort of landscape. So I'll let the others sort of chime in also. And that's sort of the general broad overview of how, people who are going to review your application are going to look at what you've done.
Yeah. All right, so now let's get into some very specific things. So Achint, in terms of how do you write your research experience in the IRAS CV, how do you position it? Since you've been through this process and you've completed your preliminary year as well, what are your thoughts? How should students, position in the IRAS CV? What do they look for?
Right. So, to those who have already applied in ERAS cycle before might be aware, like ERAS has a lots of sections where you can mention about your research work. Uh, Suppose if you have a institutional research experience, like you have held position of research assistant or research volunteer or research associate, etc., then you can fill it up under the section of research work in ERAS. They have a specific section regarding the research work. Otherwise, if it's on volunteer basis, you can put that thing under the volunteer work section. If you are being paid for a particular research, you can also mention that under the work experience. Apart from that, ERAS also has the section for publications. Anything that you have published so far, or you have submitted any journal article or any abstract or anything like that, you can put it under the publication section. So ERAS has a different categories like peer-reviewed journal article, abstract, online publications, others, and you can choose one of that category and mention about your research under that. If suppose if you have presented or attended a particular conference, and or maybe you presented poster, or you might have given oral presentation at particular conference, or you are just a part of that particular abstract, still you can mention that thing as a poster or oral presentation along with the detail of that particular conference in the ERAS. So these are the few ways of mentioning your research in ERAS application.
Yeah.
So
Thank you. Yeah. So then I guess the obvious question, and I'll start with you and maybe then move to Rahul, is, what are the skills that this kind of a research project or publications, or if you're involved in research, what skills do you get that help you in residency? Is it the analysis? Is it learning of the tools? What are the skills students should be looking to get?
yeah. So first of all, research is gonna boost your ERAS application, because none of your ERAS section will be empty if you have research experience and the publications. So obviously, if you are doing research somewhere, you gonna learn, you're gonna acquire some research skills. Like apart from that, you will develop a mind capacity to do analytical thinking from that experience. And during your research experience, you will be doing literature search, data gathering, analysis, writing, and in this whole process, uh, you will be developing a skill to better understand these already published research articles, how to interpret their result, and what's their relevance. And all this thing will enable you to better understand or practice evidence-based medicine while you are working as a resident. Moreover, as Dr. Panala told, like uh, uh, most of the programs required uh, residents to have some publications while they are doing residency, and they are also encouraging research among the residents, and sometimes they prefer the the applicants who have a published or who have a prior research experience while choosing them. So if you have a research experience before the start of residency, it will gonna give you extra edge during the residency to conduct your own research. And uh, and if you are working in a research team or you are part of a team who is doing research, then obviously you will acquire the skills of being a good team player. And so these are
Okay.
the few benefits of the having a prior research experience. I will let Dr.
Okay.
Pranala to comment if you want to add something.
Yeah. So a couple of things. First, if we can take questions after the session, because then we can record them also. The chat just gets missed. So if you guys can ask, if you can wait for about 10 minutes before you ask the question, so I'll read the questions and our panelists can respond also. But yeah, Rahul, go ahead. In terms of the skills students should look to acquire as part of any research project.
Yeah, so the most important thing, just like Achint was saying, the most important thing is how you look at, the critical thinking. The critical thinking becomes the most important thing, and that's how you, by being part of these, you tend to acquire those skills, how to look at something, how to evaluate the evidence, because you're going to do it every day once you're practicing, because there'll be new studies, there'll be new data that'll come out, and you have to look at that data and see how you want to implement that into your practice. So this is not just to get into residency or, just to put it on your CV. These are skills that are going to be important for you for the rest of your life. It also makes you a different takes you to a higher level in terms of what your involvement is. So what you will realize quickly is that you require a very, very high level of accuracy and commitment. If, let's say you've done something and you want to put a poster together or an abstract together, it's not uncommon to go through 8 or 10 drafts of that abstract to get it right. So that process is a very educational process, something that more than likely you're not used to in your regular medical school training, because you will be held to a very high standard. Your data needs to be accurate. You need to be able to stand behind your data. You need to be able to write effectively, communicate effectively. And so these are all the things that if I was a program director or if I was an interviewer, I was looking at your CV, and I was looking at what you've done and with this, and I know we'll talk about this a little later, but also not only what you've done, but are you able to understand the question, the scientific question, and are you able to defend what you've done or explain what you've done then becomes very, very important. So it's a bit different from, you know, what you do daily in clinical life, but I think it rounds you off very well as a clinician and makes you a better physician overall.
Okay. All right. So, you know, just I'll stick with you. The most important question, I guess, students may want to know. What are the typical questions you ask, or, you know, what are the typical questions on research students can expect as part of their residency interviews if they have mentioned research or, you know, some publications on their CV? So, Rahul, what typical questions students should expect?
Yeah. The first thing I would say is expect the questions. If you have done something, then I can guarantee you that you will be asked the question. One of the most common mistakes I see in interview preparation and interviews is that people have something on their CV, but when I ask them something to ask them to explain about it, they don't have the ability to explain that in great depth, right? So let's say you've worked on something. Let's take an example. You've worked on the role of statins in something. Now, you're the person who worked on that project, right? So if I'm sitting down in an interview, and I usually will start out with a very generic, open-ended question, because that will most likely not be my area of interest, but most people you're speaking to will be very experienced that they can grasp the core clinical concept and the question you're asking very, very quickly. And so it'll be a very open-ended question. Oh, this sounds interesting. Tell me about what you're doing.
Mm-hmm.
And the way to answer that question is a very succinct, you know, not more than a minute or two, you know, sort of a explanation of what the clinical question is, how you're going about studying it, and what your main result is. You know, this was a retrospective study that we looked at to, you know, look at the role of statins in heart failure. We looked at about 10,000 patients, and this is what we found, and this is why we think it is important. Okay? So then the question comes up is, do you understand the science behind it? So what is the association between statins and this? Why did you look at this? Okay? Why did you look at this and not something else? Why did you pick this kind of study that you did? Oh, why did you look at a retrospective study, and what were the mechanisms for doing that? And then what is the importance of your results? Oh, wow, so you found this. How do you think it's going to change your practice, or what do you think this means? So you see, you are expected to know anything and everything about your research and anything related to that research project, because the person sitting across from you assumes that you've done an exhaustive literature search, you've really thought about this question, and you're able to tell me a lot about it. But more important than the specifics of what you're telling me in that is, I'm able to assess and evaluate you, A, your commitment, B, your depth of involvement of, if you take something on, how much do you really take it on, and how much do you get involved? Are you very superficial? You know, you're doing it just because you're doing it. What your understanding is, and how meticulous you are, and how you communicate about it, and how passionate you are. If I'm talking to somebody who's done a lot of work but is not passionate about it, it really sends me a very mixed message that somebody is doing it but they're not really interested. So to put it all together, when you have something, projects on your CV, you need to know anything and everything about that project. What the hypothesis is, what the study design is, what your results are, how they're going to impact, what your next steps are. You need to know pretty much everything about that area of what you're working on. And be passionate, practice, of how you want to describe what you've done. And, this can be one of the biggest strengths for you in your interview.
Very good. Thank you. Now, before we take the questions, I'm going to ask Anchit to talk about the course that, we have just launched. So give me 1 second. I will bring it up. I hope I can. Yeah. So Achint, if you can talk about, what we are launching, and yes, here it is. So what is this research course, and how will we help the IMGs and the Caribbean grads?
Okay, Pawan. So, so, so we have designed the course that will train the students in research methodologies, as well as uh, we will also uh, offer the opportunity to get the hands-on experience with real data sets or the review articles that we will be working on. So depending on the project, the student will have opportunity to collaborate with the other persons that are involved in the particular research project. They may be residents or attending. And after all this, our plan is to publish the particular project that students are involved in. So we have basically designed two courses, two options for the course. The first one is the starter research course, and the second one is the advanced research course. So in starter research course, uh, student will be involved in one research project as a co-author, and it will yield one full research article, which we call manuscript, and one conference abstract. The advanced course will have two projects that are assigned to a particular student, and it will yield two manuscripts and 2 to 3 conference abstract out of it. And in advanced course, student will have an opportunity to be a first co-author, depending on the level of involvement by that student. And so how we will gonna teach you and how it will work. Let me tell you briefly about that. Uh, so we plan to enroll 5 students in each group. We want to make a group of 5 students. For each group, we will conduct a initial lecture or interaction, and we will decide on the topics that particular group is going to work on. And so our goal is to uh, uh, finish the whole thing, to get the first draft of particular publication in uh, 7 to 8 weeks. Uh, so we will be holding a class bi-weekly, uh, once in a 2 week, for 1 to 2 hours, and we will be talking about that particular research project, and any progress that we are doing on that particular project. Uh, and along with this, during this whole 8 week journey, you will be learning how to publish uh, from from the research project. And our plan is to get the first draft of manuscript or abstract after the 8 weeks once we start. And depending on the projects, we will be also involving residents and attending to increase the quality of overall our publication.
Yeah.
Yeah, Pawan. So Anything else you want to add?
All right. So yeah, so no, that's good. Yes, a couple of just to summarize, it'll be about 6 to 8 weeks. You can see what we'll do in the starter course and the advanced course. It's actually now listed on our website. So if you go to our website, you should be able to see the details. And we want to make sure that we can, teach you some of the very critical skills that will stand you in very good thing as part of your residency journey or, the math journey, because based on our experience and our panel, over the last 4 to 5 years, we have realized what they look for when it comes to research. And of course, our panel, if you will see, they are experts in their domain in research, and Achint, who's going to lead this, you can, read about him on our website. He's very prolific. You can read his ResearchGate profile and also on Google in terms of the number of publications that he's been able to do over the past few years. So thank you, Achint. Now we will now open to questions. If you have questions, you can type, on anything and everything we spoke about today. And I'll probably read the questions so that those of you who may want to come back to this webinar later can listen in as well. First question, if I'm looking for a physician mentor, who can I contact and what is the process? So Rachna, you can contact us on our website. There's also a WhatsApp number. We can talk about what program or course you're interested in, and we'll go from there. Here's the number. I'll list the number as well. You can WhatsApp this number. This is the US number, so we'll go from there. Other questions?
It says, what is the good number of publications to be in a safe zone for internal medicine? So
okay,
I think it's a good question in the sense that there is no specific answer to that. It really depends on what you want. It's both quantity, quality, and, in the combination of those two that really make a difference. So there's no magic number. It's what you've done, what the quality is, and how you're able to speak about it.
Okay.
Can a case report?
Yeah, I was going to read that. Yeah, I was just going to read the question. Can a case report be considered a publication?
Yes, if it is published. Obviously, again, it goes back to the quality discussion, right? It goes back to the quality discussion. So there's a spectrum of research publications starting from case report, which is at the bottom of the sort of the pyramid, to going up to a randomized clinical trial, which would be at the top of the pyramid. So where you are in your stage of life and your stage of training, I think starting with case reports and starting with those can be helpful, but don't fall into this trap of, just filling up your CV with a bunch of case reports. So try to maintain a balance. I think instead of focusing all your efforts on trying to get a bunch of case reports and looking at 5 or 6 case reports, even if you get one good research project that you're involved in that is a scientific project that has the potential or can lead to a publication, that'll have more weight than 5 to 6 case reports.
Yeah. Maybe Achint, you can take this next one. Does research in different specialty help? So like if I am doing research in surgery, does it help in an IM kind of an interview?
So basically, so it may help, like any research experience in any field might help in other branch, because mostly whatever research you are doing right now, it might be in surgery, but you are learning how to conduct the research and you are developing the the critical thinking that is required, and that's what the programs might be looking for. So that so you will be having the capability. Uh, so and if you have that, then it's not gonna be the issue for IM interview, I guess. But again they will ask again the program will think that why are you doing research in surgery, uh, or IM is a backup branch for you or something like that. So you have to be prepared for that kind of questions as well.
Okay. I'll take the next one. I get this very often. If I do a PhD, is it a good sign? Can that balance my long year of graduation, more than 8? So here's the funny thing about residency. If you have home country residency, that is really, really very beneficial. If that's what you mean by postdoc, maybe not, because that gives you the clinical skills they are looking for. If you are going in for a PhD, it makes it very hard because the assumption is you are away from the clinical field. However, if you have good scores, excellent scores, let me put it this way, 250 plus and all, and you have a PhD, you can probably get a job in a university setting as a some research fellow or something. You can make contacts, professional contacts, and then go in for a match. It will be a long journey. PhD is not that helpful as doing, say, a home country residency or even doing an MPH. I mean, those degrees we have seen from an IMG perspective are beneficial, more beneficial than a PhD, but not to say that PhD cannot help. It is very rare, but can help.
So one
Next.
thing I want to say about the PhD though, it really depends. If the question is, should I do a PhD now to try to help me get into the residency, then the answer is no, most likely no.
Yeah.
Unless you're in a small category where you want to focus on a very specific sort of, a branch or something. But if the question is, I've done postdoc for 2 to 3 years in somebody's lab, or I have a PhD and now I'm going to apply, the answer is it will likely help, but it depends on what you've achieved during your PhD and what you're applying for. So let's say you're applying to neurology and you have a PhD in neuroscience, then it's obviously going to help you, right? But if you have a PhD in like basic sciences and molecular biology, you've spent 8 years in the lab doing molecular biology as a PhD and then a postdoc, and now you're applying to internal medicine or family medicine, I don't think it's going to help you.
Yep. All right, last couple of questions. Achint, maybe you can take this. Is it okay to mention a case report that was published on a predatory journal due to lack of funds, and that was a low-cost option? So I published a case report in a predatory journal. Should I mention it on the IRAS CV?
If I would suggest if any kind of research you have done, you can mention it. Maybe you will not find the category if it's not if it's not the PubMed index journal. So because the IRAS category will want you to enter the PubMed ID as well. So in that case, you can choose the option which is called other, and just mention about your research, mention about the author's title and the name of journal, and keep it like that. So there is nothing wrong in mentioning that in a IRAS application, I guess.
Yeah. Next question, is public health research relevant for CV if applying for IM? I would say why not, but let me, again, Achint, you can take that. If the research is in public health, should I be mentioning it on the CV? I guess for IM, if I'm applying to IM.
Yeah, definitely. See, if you are applying for IM, so any research, any medicinal research you have done, you can mention it in IRAS, because again, I will say the same thing. the program is looking for your capability to do research. And if you have publications in the same branch, then it's going to be win-win situation. But even if you have a research in other areas like public health research or like other than IM research, you should definitely mention that in your application
Yeah.
if you are predominantly applying in IM.
Okay, probably the last question, so maybe Rahul, you can take this. Deepa is asking, is home country residency in another, non-clinical branch, I guess, will help me in getting a clinical specialty like I am here? Because the research would be related to what I did in the home country residency. So I guess we're talking about micro or some of those residencies which are, in the home country, non-clinical.
Yeah, that's a hard one. I think it would really depend on what you have done during that residency and how you are going to project how it's going to be helpful for you. So, for example, let's say microbiology. Now, what you could, for example, let's say somebody has a PhD or a home country residency in microbiology. Now they want to get into internal medicine, then one way they could say is, I've done this, this, and this in microbiology. I have a lot of clinical experience. I have a lot of this, and I want to do internal medicine because eventually I want to do infectious diseases. I want to be a clinical, clinical sort of infectious disease person with specific interest in this, this, and this. Let's say in that microbiology residency, your research was on viruses. You want to say, I could do infectious disease and subspecialize in, virology and biological diseases and things like that. The problem that comes is a lot of these non-clinical specialties that are part of medical specialties outside of the U.S. here are mostly run by PhDs, like, microbiology, anatomy and physiology and those kind of things. Those are mostly run by PhDs. So I think those are all helpful. It really depends on what you say you will do with them. You see what I mean? And to say, come outright and say, I did microbiology, I did this, now I want to do IM because I got a lot of clinical skills, things like that, but I really missed being with the patient. I can bring a lot of information from that residency and apply it to become a better internal medicine doctor, but what I've realized is I really want to do internal medicine and just be open about it. And people will understand that. The one advantage of training in the U.S. is that people are open to you changing your mind and, trying new different things. And just because you did something before doesn't mean you are stuck in that forever. You just have to be able to express that.
Okay. And I guess how can we join your course? You can go to our website, and if you're interested in the research course, there is enrollment right there under research course. We will start next Saturday or Sunday. You can look up the website. The contact is right here. You can call, WhatsApp, or send us an email, and that is, that will help you. If you have any questions, of course, you can ask us through email or WhatsApp or things like that. So that will be the way to go if you want to enroll in our course. I want to thank our panelists. Thank you very much, and thanks everyone for joining this session. Hopefully it was useful to you.